In this lab, we'll be discussing the muscles of the head and neck. I'll be following my muscle practical checklist. The muscles we'll be doing in part one are all the way on the left, the first column. We'll start by taking a look at the muscles of the scalp area. We'll then drop down, we'll take a look at the muscles of the eye, the nasal area. We'll take a look at the muscles of the mouth, and then finally we'll finish up on this part one with the muscles of chewing. The model we'll be using for this lab is known as our head and neck model. I just want to point out a couple things before we look at the actual muscles. If you notice on this side of the model, we have all superficial structures. So these are structures that are closer to the surface of the skin. If I turn the model around, notice the superficial structures have been removed, and this is the deep side, and this is evidenced by, you can see the parietal bone here, the frontal bone. So these are the things that are deeper, are going to be underneath the superficial side. All of our models, I should say most of our models in the lab, you'll notice there's a superficial side and a deep side, and that's why the model doesn't look the same on the left and on the right when you looked at it from the front, because of that reason. Also, I just want to note the muscles that we're going to see in this lab video can also be found on other models also. They're all basically the same. It's just some models are bigger, some models are smaller, but you should be able to find most everything that we're describing here today. So let's go to our on our checklist. We'll take a look at the first three structures. Some people actually call this one muscle. They call it the Occipito frontalis muscle. I'm going to divide it into two muscles that are connected by a broad, flat tendon known as the Galea aponeurotica. All right, so this whole gray structure over here is a broad, flat tendon. That's what an aponeurosis is. It's called the Galea aponeurotica. If you look in your lab book, they call it the epicranial aponeurosis. All right, so either name is fine. So let's take a look at the occipitalis first. So this muscle back over here is the occipitalis. It's named because it's located on the occiput, or the occipital bone. And then this one over here is going to be the frontalis, right? This would be right on our forehead. This is right on the frontal bone. Okay, so frontalis, the Galea aponeurotica is the tendon that's going to connect to the occipitalis. And I labeled it. So let's take a look at what they do. When the occipitalis and the frontalis muscle contract, if you notice, the frontalis muscle is kind of attaching to right where our eyebrow would be over here. When they contract, they pull the whole scalp backwards this way, and that causes us to raise our eyebrow. It actually produces a little bit of a wrinkling in the forehead. So if you would actually just put your fingers on your forehead right now, raise your eyebrows, you can feel the frontalis contract. All right, so these two muscles work together to elevate or raise the eyebrows. The next region on our checklist we want to look at are the muscles about the ear. So we're going to kind of take a look at this whole area here now. The first muscle we're going to look at is called the temporal parietalis. This muscle was named based on its origin and insertion. So it starts here where the temporal bone is, then the fibers go up and they attach to where the parietal bone is, right? So temporo parietalis. But notice this muscle is attaching to the side of the Galea aponeurotica. So it's actually blending in to that broad flat tendon. Right? So that's the temporo parietalis. The next three muscles are about the ear. This one here is the anterior auricular. This one here is the superior auricular. And then right behind the ear, this is the posterior auricular. Their actions are to move the ear, we're going to see. Okay, so those are the three auriculars, 2 and 3. And then this one up over here is the temporo parietalis. So let's take a look at their actions. The temporo parietalis Since this muscle is attaching to the Galea aponeurotica above like this, when it contracts, it pulls the Galea aponeurotica down, and it actually tightens the scalp. It kind of reminds me if you were to put a ski cap on your head and then grabbed your ski cap on the sides right above your ear and pull the ski cap down over your head, that's what this muscle would be doing, kind of the equivalent. The anterior auricular pulls the ear forward. The superior auricular pulls the ear up, and the posterior auricular pulls the ear down. So the auriculars pull the ear in the direction of their name. These are the muscles if you have a dog at home, let's say, or you watch an animal out in the wilderness. When they hear something, right, they lift their ears up, they move their ears so they can hear better. We have the exact same muscles. Even people that can wiggle their ears, they're typically using their superior auricular and their posterior auricular. They're pretty strong. This muscle in the front, the anterior, is not that strong. It's actually missing on some individuals. Okay, so those are the muscles that are about the ear. These next muscles are going to be around the eye. So I have 3 of them on our checklist that we want to be able to identify. The first one starts here, right on the inside of the eye, and then it goes up like this. All these little ridges going up like here, right underneath our eyebrow. So this whole muscle here going up underneath the eyebrow is the corrugator supercilii. The second muscle we're going to look at is actually right in our lid. This is called the levator palpebrae superioris, right? It's right in our eyelid. And then this big guy, you can't miss it. It goes all the way around like this. All the way around like this. Big, big circular muscle is going to be called the Orbicularis Oculi. Orbicularis Oculi. So let's take a look at the corrugator first. So like I said, this starts on the inside of the eye, goes up underneath the eyebrow, right, the skin of the eyebrow. When it contracts, it takes the skin of the eyebrow and it pulls it down and medial. So it would actually cause like a frowning type of appearance. It even causes a little bit of wrinkling right over here. So this is going to pull the eyebrow down and medial. The levator palpebrae superioris, let's dissect the name. Levator means to lift, palpebrae means the lid, and then superioris means up, right? Superior. So this tells you what it does. It lifts the lid up, and that's what allows us to open our eye. Finally, the big muscle here, again, don't forget it's this whole muscle. I just labeled it at the bottom, but it's this whole circular muscle here. This is called the Orbicularis Oculi. Orbicular means it's going in a circle and it's around the eye. So this muscle actually closes the eye. If you were to kind of squint hard or kind of close your eye forcefully, you would feel this muscle contracting all around your eye. So this is going to close the eye. The next muscles we want to look at are the muscles about the nose. So there's 2 of them. There's going to be one here. This muscle, if you notice, here's the nasal bones. Starts on the nasal bones and then it goes up to kind of between the eyebrows right over here. So this is going to be called the procerus, just kind of running straight up and down. Procerus. And this one here running right over the bridge of the nose, right? One muscle would come up on this side, and then the other muscle would go down on the other side. It kind of reminds me of like a breathe right nasal strip that people put on to breathe a little bit better, or athletes use sometimes to get more air in. This is called the nasalis. So let's look at the procerus first. So like we said, it starts on the nasal bone, goes up to the skin between the eyebrows. When it contracts, it's going to take the skin between the eyebrows and pull it down. So it's actually working with the corrugator supercilii. They're both working together to pull the eyebrows down. When 2 muscles work together, we say they are synergist or synergistic. It means that they do the same thing, right? So the procerus pulls the eyebrow down. If you've ever worn those breathe right nasal strips, right, you'll see that the nasal strip actually causes your nostrils to puff up so that you can get more air in. Well, That's exactly what the nasalis does. It runs over our bridge of the nose and it flares the nostrils when it contracts to bring more air in, right? So its action is just like a breathe right nasal strip. So that's the procerus and the nasalis. Now, the majority of the muscles are going to be around the mouth. So I'm going to kind of divide it up this way. We'll do these muscles first here. Just everything above the arrow we'll do first, and then everything below the arrow we'll do second. The first muscle we're going to look at, it looks like it's number 8 on this model, kind of starts where the infraorbital foramen is and the Orbicularis Oculi. You can see it right there. This is the beginning part. Now this muscle goes straight down, but it should go down to the lip, like right over here to the upper part of the lip. But notice on this model, they cut it so that we could see structures underneath. So just kind of remember, even though it's not showing it on this model, it does go down to the lip. When you look at it on the diagram in your book, you'll see the whole muscle. So this muscle is known as the levator labii superioris. Now, blended with it, right, they actually blended together. This muscle here, it looks like 8A, goes back, but not to where the levator labii superioris started. It actually goes back to our cheekbone. If you follow this here, this going back to the cheekbone is the Zygomaticus minor. If you remember, the zygomatic bone is our cheekbone. Right? So since it's coming from the cheekbone, they call it the Zygomaticus minor. That's that one there. The next muscle we're going to look after that is a little bit, we're catching a glimpse of it right here. This is called the Levator Anguli Oris. This muscle actually, we lose it, goes right down to the corner of the mouth. So we only see a part of it. We don't see the part that would be under here, but we do see a little bit here. This is the Levator Anguli Oris. The next muscle we're going to look at also starts on the zygomatic bone, the cheekbone, and then goes to the corner of the mouth, right? Notice it's not going to the lip. The Zygomaticus minor is heading to the lip. This one's going to head to the angle of the mouth. The fourth muscle we're going to look at is the buccinator. This one is interesting. This one's actually in the wall of our cheek, right? So it actually is in the wall of our cheek. And then we'll take a look at this one here. Goes from the corner of the mouth and kind of heads back towards the ear area, back this way. This is going to be called the risorius. Okay, so let's take a look at the levator labii superioris first. We'll dissect the name. Nothing to memorize. If you understand the name, we'll know exactly what it does. It lifts. Now, labii means lip. Superior would be up. So since this muscle comes down, remember what I said before, it goes straight down to the lip. This is going to lift the lip up. Let's just say you had something in your, you wanted to check to see if something was in your front teeth. So you go to the mirror and you lift your lips so that you can see your teeth. That is your levator labii superioris muscle contracting. Since the Zygomaticus minor muscle also blends with the levator labii superioris, they work together. They're going to be synergistic, right? So you can almost consider this like one muscle as far as the action. The levator anguli oris, let's look at the words. Lift the corner of the mouth, right? Anguli meaning the corner of the mouth. So this is our first muscle that would actually be a smiling muscle. This is going to actually cause us to smile. The Zygomaticus major starts on the cheekbone, the zygomatic bone, also goes to the corner of the mouth. So when it contracts, it's also going to pull the corner of the mouth up and back, as in smiling. So this is our second smiling muscle. The buccinator right here is in the wall of the cheek. Now this muscle actually compresses the cheek. If you were to say drink some soda out of a straw and you compressed your cheek to pull the soda up into your mouth, that would be your buccinator. This muscle actually contracts while we're chewing to help keep food, inside your mouth and not going between your teeth and your cheek. The risorius muscle, this muscle actually means to smile. Risorius in Latin is meaning to smile. So this is our third smiling muscle. This is going to take the corner of the mouth and kind of pull it back. Okay, so Levator, Labii Superioris, and Zygomaticus Minor, they work together to lift the lid up. Our three smiling muscles, Levator Anguli Oris, Zygomaticus Major, and Risorius, they cause the smiling. And the muscle that compresses the cheek is going to be the buccinator. The remaining muscles around the mouth we're going to look at are going to be this big muscle here. It's kind of circular. We would see it go around the whole mouth. This is going to be the Orbicularis Oris. I almost slipped. This is actually the Orbicularis Oculi. Students do that commonly. They make that mistake. This is the Orbicularis Oris, right? Oral meaning the mouth. Then we'll take a look at 1, 2, and then the third muscle down over here. These three muscles, if you notice, are all below the lower lip. This is going to be the Depressor Anguli Oris. You can see it's going to the corner of the mouth, hence the name Anguli. This one here you can see is going to the lip, so it's easy. This is going to be a Labii muscle. This is the Depressor Labii Inferioris. And then this one here on the chin, if you remember from our very first lab, mental area was the chin. This is going to be called the Mentalis. So let's take a look at them. The Orbicularis Oris. So as the name implies, it goes around the mouth in a circle. This muscle, when it contracts, actually helps to protrude the lip, close the lips, even when we speak, that type of thing. All right, so it's going to move the lips. The Depressor Anguli Oris, if you look, it's this triangular muscle here. It almost looks like a triangle. Goes right to the corner of the mouth. So it's going to depress the angle of the mouth, as in grief, frowning, that type of thing, right? So again, if you read the name or you know the name, nothing to memorize. It depresses the corner of the mouth, right, which would be grief or frowning. The Depressor Labii Inferioris, right, since it has the name Labii, it's going to the lower lip. This is going to drop or depress the lip down, right? So it's going to bring our lower lip down. So if you were going to look at your lower teeth, you would be contracting that. And then the Mentalis muscle is right on the chin area. When this muscle contracts, it actually causes us to protrude the lower lip, as in pouting. Right? If you put your finger on your chin and then just kind of push out your lower lip, you'll feel the Mentalis muscle contract. The last muscle we want to consider as a facial muscle is going to be called the platysma. So this muscle actually starts in the facial region. It actually blends in with a lot of the muscles we just looked at. Here's the Depressor Anguli. Here's the Risorius. It actually kind of just blends in and attaches to those muscles. And then it's an interesting muscle. It kind of drops down over the jaw, goes over the neck, down the neck, over the shoulder. It kind of goes over the back of the shoulder, the top of the shoulder, kind of into the front of the chest area. Kind of reminds me of a waterfall. This is called the platysma muscle. It's a very thin muscle. It's right underneath the surface of the skin. When this muscle contracts, it forms like the ridges in your neck. If you were to kind of tighten up your neck muscles and you kind of get those ridges forming, that would be the platysma. In animals, an animal uses it to shake the skin of their neck. Let's say they want to shake off dust or they want to shoo away a fly or something like that, and you watch a horse maybe and they shake the skin of their neck. That would be the platysma muscle. So that's all the muscles of the head and the face. We'll finish up this part one of the head, neck, and face muscles by looking at the muscles of chewing. Right? Mastication means to chew. So you'll see on our list that there's 4 of them. The first one we're going to look at is the masseter. This is one of the most powerful muscles that we have in the body. We see it really well on the superficial view. The superficial side of our model. This muscle actually starts kind of from the zygomatic arch. Remember the zygomatic bone was here, right? We can see the Zygomaticus Major. So it starts on the zygomatic arch, then the fibers go straight down to the angle of the mandible. And you can see it's a thick muscle. And when this muscle contracts, it powerfully pulls up the mandible so that we can crush and pulverize our food. So like I said, it's one of the strongest muscles in the body. Right? So that's the masseter. On the deep side now, I turn the model around. We've taken all the superficial structures off to see this one. Look at this big muscle here, this giant muscle. It's kind of on the whole side of our head. It's on the temporal bone, it's on the parietal bone, catches the occiput a little bit, even a little bit of the frontal bone. Big, big muscle here. This is called the temporalis. The fibers go down, go underneath the zygomatic arch, and they actually attach to the coronoid process on the mandible. If you remember, that little pointy part at the top of the ramus was the coronoid process. And this muscle also pulls the mandible up very powerfully in chewing. Okay, so these are the masseter, temporalis. The last two chewing muscles we can't see unless we cut the mandible away. So if you notice on this dissection, we remove the mandible. Here's where the ramus of the mandible would be. It kind of would run straight up and down. That's been taken out, and that exposes two muscles called the pterygoids. We have a lateral pterygoid and a medial pterygoid. So if you remember, the pterygoid process was part of the sphenoid bone. So both of these muscles are actually attached to the lateral plate of the sphenoid bone, and they go to the inside of the mandible. The top one goes from the sphenoid bone to over where the TMJ is, where the temporomandibular joint is. This is the lateral pterygoid. The medial pterygoid also goes from the sphenoid bone to the inside of the ramus of the mandible, which has been removed. So we see part of it here. So this whole big piece of muscle right here, it's underneath these nerves and blood vessels. All of this is the medial pterygoid. Again, the only way we could see these, because they're inside the mouth, is by removing the mandible bone. So all four of these muscles, masseter, temporalis, lateral pterygoid, and medial pterygoid, are muscles of chewing, right? Muscles of mastication. That would be their action.